Your microphone.
Oh, sorry. Yeah, hi. I'm an integrated medical practitioner and a cancer coach for breast cancer patients primarily, and I'm really grateful for all the research that's coming out, and I'd like to know if there's any more specific research on what I think Dr. Osborne was talking about with related to systemic IV therapies in conjunction with traditional, conventional pharmacology, perhaps. I know that we have many out there, high-dose vitamin Cs and ozone therapies and all kinds of other therapies, but I don't know what exactly exists in terms of the research today. And if anyone on the panel besides Dr. Osborne mentioned some of these.
So if you're talking about alternative therapies specifically.
Complementary.
Complementary, yeah. I'm not aware of any of those that have been really shown through careful study to reduce the risk of metastatic disease developing in people. There are some alternative therapies that are being investigated, but so far the results have been on the bad side. So for instance, so-called antioxidant vitamins, vitamins A and E, were used as a prevention trial in smokers because they have low levels of those. It increased the risk of lung cancer and lung cancer deaths. Most recently, selenium was used to prevent prostate cancer. It increased the amount of prostate cancer.
I've heard mostly about the high-dose vitamin C. I wasn't familiar with the other vitamins.
So, but there are other ways to deliver systemic therapy that may augment our current therapies, and that is by combining the standard therapy, which might be an ER blocker like an aromatase inhibitor, with another drug that can block one of the escape pathways that the tumor cell uses to outsmart the aromatase inhibitor. And there was just two studies presented at the San Antonio meetings in December doing that. One in ER-positive disease and one in HER2-positive disease using the second drug to block an escape pathway. And both were very, very exciting data. So that's one way. And then Alberto presented some data today on there's probably no drugs yet, but you may want to comment on the immune system and how that might be modified to get at the micrometastasis.
Yes, Alberto, why don't you make a comment about it?
Sure. I think that immune-based treatments in cancer, have largely been an unrealized promise. Part of the issue is that the immune system is incredibly complex, and we've learned over the last 20 years that the tumors can adopt different strategies to outsmart the immune system. But I think that with a lot of the research that's occurring these days, I think that in the near horizon, probably immune-based treatments will be something that will be shown to be effective, and we'll find better ways to incorporate traditional vaccines with other strategies that may block the suppressive, the ways that the tumor can suppress the immune system.
Thank you.
Please.